give you a bit of background about the clip. It was about 25 years ago, at the height of the HIV epidemic, MTV Staying Alive Foundation was launched in response to the need to get life-saving information to young people. Storytelling with a purpose has proven impact, and we all know that. Using a combination of approaches, media and peer education, MTV Staying Alive Foundation has supported young people in making informed choices for their lives and their well-being. MTV Sugar, how many of you have seen MTV Sugar down south? How many of you enjoy MTV Sugar down south? Can there be a bit more excitement? How many of you enjoy MTV Sugar down south? Woo! Woo. Great. So this very short video clip comes from season 2, so some of you may have seen it, which tells the story of a transactional relationship. It's a reality for many young women. In this clip, you will see Daneo, who has a relationship with an older man to help her through college. Later in the story, she will also go on pre-exposure prophylaxis, an option that wouldn't have been available to her a few years ago, and offering her extra protection, as you will see, she's quite well aware of the risks. So, Charlotte, if you are able to do your magic, let's hope the video works and there's sound. That sounds promising.
I got too much.
Whilst we wait for the video, perhaps you can tell your neighbor whether you think transactional sex or sex work really matters in terms of the term. Have a quick discussion with your neighbor. Is it transactional sex? All right, I think let's settle down. I think they're almost ready with the video. I hope that you all agreed. Maybe settle down, please. Shh. Ishmael, Jenny, thank you. I hope you all agreed a prepaid package in the conversation with the person next to you. Is the video ready, Charlotte?
Oh, break. I thought you and me. I thought we were... Look, I got too much keys. I've been on the road now, busy overseas. So hit me on the phone now. Oh, break. Hey, can we talk?
Now you want to talk.
I was just trying to understand. And what did I see? Are you really with that man? I thought you and me, I thought we were starting something.
Now you want to talk. We could be. I like
Then why are you sleeping with rich old men?
I am not sleeping with old rich men. I'm having sex with one man.
But even know who else you slept with. What you're doing is dangerous, Danae.
You think I'm stupid? I'll never have sex without a condom.
You're not fine. You're right. I just don't get what you're playing at, Danae.
This isn't a game for me.
I was just trying to
And
understand.
it's complicated.
What did I
You
see?
wouldn't understand. Shouldn't you be having this conversation with yourself? I mean, I've seen you with at least 4 different girls since we started. Oh, what?
Are you really with that man?
You're just holding hands?
It's different. But I thought you and me, I thought we were starting something.
We are. You know what, Q? We could be. I like
Then why are you sleeping with rich old men?
I am not sleeping with old rich men. I'm having sex with one man.
But even know who else you slept with. What you're doing is dangerous, Danae.
You think I'm stupid? I'll never have sex without a condom.
You're not fine. You're right. I just don't get what you're playing at, Danae.
This isn't a game for me. And it's complicated. You wouldn't understand. Shouldn't you be having this conversation with yourself? I mean, I've seen you with at least 4 different girls since we started. Oh, what? You're just holding hands?
It's different. They don't pay me for sex.
You know what, Q? Go to hell.
Thank you. Applause, please. It's a complex situation, but hopefully highlighting some of the challenges of transactional sex, but also the impact it has on personal relationships. We're going to move straight into a presentation from our colleague Lysias from and HIV in the region. Can we have the slides, please?
Thank you, Sean, and greetings to everyone. We have heard from the beginning of the conference yesterday during this ceremony, the opening ceremony. Winnie, our executive director from UNAIDS, she presented the progress made so far, and she highlighted a lot of data, especially around the new HIV infections. What I'm going to do is to drill down to Sub-Saharan Africa, where the focus of this discussion is going to look at, and also looking at adolescent girls and young women. So to put it into perspective, it's always important. I'm not sure how many of you are aware or are familiar of UNAIDS global targets. The end goal is to reach 370,000 new HIV infections per annum, or an annual number of lower than 370,000 new HIV infections globally. That is the end goal. If we can reach this target, then in terms of our midterm targets, 2025 targets, we are within reach to reach the 2030 goal of ending AIDS as a public health threat. And then next slide. If you look at how we can assess ourselves towards these 370,000 HIV infections annually, and picking a few countries, this slide is just showing how we are doing in terms of reducing new HIV infections, picking a few countries from the Sub-Saharan Africa region, and comparing 2010 and the current year, which was 2022, which is the latest estimate from UNAIDS. we can see across these countries that there's been quite good progress in reducing new HIV infections, ranging from 71%, we see here in South Africa for the countries shown here, to about maybe 20% in Mozambique. We can see the variation in terms of how new infections are reducing annually. And this slide, what's showing is when you compare the reduction in new infections for adolescent girls and young women compared to their male counterparts, we can see that it's faster reduction among male counterparts as opposed to adolescent girls and young women, which highlights an inequality issue, as we've been talking about inequalities from the beginning of this conference. Next slide. But how is the picture when you look at HIV infections among adolescent girls and young women? These maps are data that is coming from what are called sub-national HIV estimates that are generated by UNAIDS. And it's really drilling down up to district level. The different color shades ranging from lighter to darker are orange, are highlighting HIV incidents. We can see that across different countries in sub-Saharan African countries, there's a large variation in terms of HIV incidents among adolescent girls and young women. And when you really look at this, because these 4 maps now, they're showing where do we find high incidence among the different categories of adolescent girls and young women. The first one is showing all young women and girls. The second one next to that is showing those that are sexually active with one cohabiting partner. We can see the colors are becoming more darker. And then the third one, which is at the bottom, is showing those young women and girls aged 15 to 24 who are sexually active and having non-regular sexual partners. We can see the colors are becoming even darker. And then the last category, which is at the bottom, is showing adolescent girls and young women who are young key populations. You can see the colors are even darker, showing that depending on the level of risk, we are having high HIV incidence across different categories of these adolescent girls and young women. And this is very important when you want to program for this population to be able to know what are you targeting and what you want to address. Then when you superimpose work that is being done by different people, be it government programs, be it implementing partners such as Global Fund, PEPFAR, when you superimpose where there are programs for adolescent girls and young women onto this incidence data, you will find that only about 43% of districts of very high HIV incidence are covered by programs. And this is another concern that we need to look at, because these areas where these adolescent girls and young women at very high risk, they need to be covered by dedicated programs providing different packages of services to address that. Next slide. Then looking at incidence level only, it's not enough. We need to also address adolescent girls and young women issues in a broader sense. This slide here is just showing how we need to
Sorry,
understand.
let's just, do you mind going back one slide, please? Thanks.
So we need to understand the broader aspects of how we address issues around adolescent girls and young women. This slide is just an attempt to highlight some of those issues. So we have got social, structural, economic issues that adolescent girls and young women face that put them at risk of acquiring HIV. And also the power to negotiate safer sex, also another issue. And this results into those high incidence levels that we see either with non-cohabiting partner or non-regular partners, or being under the young women key populations. And we know that there are some interventions that can help to address these issues. Programs like comprehensive sexuality education, we know that can empower adolescent girls and young women, as well as giving them that power to, or knowledge to negotiate safer sex. On the right side of this slide is just highlighting, showing some data about adolescent girls and young women, the percentage who are currently married or in union, who make their own informed decisions about sexual relations, be it contraceptive use, and their own health care. We can see, we would love these bars to be 100%, but none of them reaches 100%. Most of them, as you go down, you see that there are even in some instances where only 20% of them are able to negotiate these things, the use of contraceptives. So it just highlights that huge gap that we have in terms of empowering adolescent girls and young women, in terms of negotiating safer sex in their sexual relationships, in terms of negotiating contraceptive use, and also being able to have that power to manage their own health care for those countries where the data is available. We would drill down as the session goes, maybe more into specific regions, for example, such as ISA, and also highlighting some specific data points. Thank you. Over.
Just turn off your mic. Thank you very much, Lysias. And in many ways, it appears as if we know what works, and it seems to be so simple. But now we are going to hear from two young women who are involved in sex work or are representing people, young women who are involved in sex work. And the first speaker is Catherine from the African Sex Worker Alliance. So Catherine, can you share with us some of the realities of young women involved in sex work being able to access HIV prevention services?
Thank you, Sean. I'm a young sex worker working in Nairobi, and I would love to share some of the experiences that we actually do face as young sex workers. So challenges that we face in terms of sex work is first of is criminalization. Us being criminalized, I coming out as I am a sex worker is a very huge barrier in my country. So I can't just come directly and start telling someone I am a sex worker because of the stigma and discrimination that comes with I being a sex worker. And in terms of me going to access healthcare provision, people are gonna be like, oh, so you're a sex worker, and the stigma starts coming in. If I'm going to a healthcare provision and I'm going as a sex worker, I won't say I'm a sex worker, but I'm gonna go and I'm gonna be like, I want condoms, I want to access PrEP, I want PEP, I want ARVs, I want, healthcare provision. And they're gonna be like, I'm not openly saying I'm a sex worker, but they're gonna be like, you've come here for a week, you've had 4 condoms. What is wrong with you? Why do you need PrEP? So that is stigmatizing me without actually saying which community I belong to. And that is gonna make me fear of going to a healthcare center to acquire the services that I actually do need. Also, the services that we face is the technical barriers that we have in terms of people who engage in cyber sex. Identifying ourselves in sex work, young sex workers are engaging in technological sex, and in terms of identifying another sex worker is gonna be difficult. They don't come out as I am a sex worker, so I cannot directly go and say this person is a sex worker. The peer-to-peer engagement and actually say, can you actually come to this place to access services? I know how to identify this person unless they come out themselves. And also in terms of the PrEP services that we acquire, the medication that we have. For example, let me use the PrEP. Most sex workers have an issue. We have been using PrEP, and currently we are using the WVN ring. However, the PrEP is a huge burden for us in terms of pill burden and in terms of safety of ourselves. Most people, our community lack enough knowledge on what PrEP is. So if they actually do see me with that thing, the stigma that comes with that, oh my goodness, a lot of people have actually registered in terms of, we do get, go to help people in hospitals. They have been beaten by people just because of having the thing itself. And also the pill burden, as I have said, every single day. For example, I'm in this meeting, I have to carry my medicine. I have to set time to take my medicine. I have to do this at this certain time. The WVN ring as well is helping women in terms of my partners will not know that I have the ring on. However, is it protecting me from anal sex? Is it protecting me as oral sex as a sex worker? So we are pushing for the long-acting injectable because this is not protecting me in any engagement in all aspects of me being a sex worker. So those are some of the barriers that we are facing as young sex workers. Thank you.
Thank you, Catherine, and also just for bringing to life and to reality some of the challenges experienced by young women identifying as sex workers. Precious, coming to you, do young women who do not identify as sex workers fall through the cracks? And what are some of the issues for young women involved in transactional sex?
Thank you so much, Sean, and good afternoon to the whole house. As maybe I should highlight that I work a lot with adolescent girls and young women, and part of the groups that we work with include vulnerable young women, as we would say, or young sex workers. Just like Catherine has said, I'm just going to allude, especially in terms of the prevention technologies for young women, the issue of pill burden, and the fact that we have been trying to say when it comes to PrEP, there's poor adherence. And one of the key things that young women have been speaking about is give us long injectable PrEP. And unfortunately, our governments come into a situation where they say the country is broke. So the biggest question is we are talking about high new infections, and those new infections in our different countries are coming from the young adolescent girls and young women. So the question is who is supposed to invest in those in the long injectable drugs? So these are some of the challenges that girls and young women in transactional sex or sex work face. As we know that you don't just wake up and become a sex worker or get into into transactional sex. We know that there are girls and young women coming from the hard to reach areas. We've got absent fathers. We've got girls who are raising their own siblings and they need to put food on the table. And the question is, if I have to go to school and put food on the table for my siblings, how am I supposed to do that? Definitely, I have to see how do I put food on the table. I'll get into transactional sex for me to ensure that I still have education and I still can put food on the table, because we know that issues of poverty comes into play when it comes to transactional sex and sex work for young women. Some of the issues that young women face is this issue of socio-economic barriers, because every time when we're looking at young women, we look at them as medical beings. The only thing we want is to provide treatment. We want to give you PrEP. We want to give you condoms. I have bigger problems. Before we come into the condoms and the treatment, what are the root causes that are pushing me into sex work or transactional sex? So nobody is going back to the root cause. We are just mopping up and hoping that at the end of the day, we are going to see a lesser number of new infections from adolescent girls and young women. So these are some of the issues that we are facing. And from a personal point of view, some of the conversations that we have had with adolescent girls and young women, and they don't identify as sex workers on the streets when we're doing some kind of a survey. They said, no, I have to pay rent, so I come on certain days. When I have money, I don't come. So, but when I need to pay rent, when I need to put food on the table, when maybe my boyfriend is no longer taking care of me, then I need to find a way to survive. So a girl is going to do what it's going to do at that particular moment, because most of the programs they look into the medical part, but they are not looking into the real needs of adolescent girls and young women on the ground. Especially when it comes to economic empowerment, we see a lot of programs that look into how do I go to school. Yes, we have programs. I'll make an example of the Dreams Project, which is a very good program where which takes girls back to school. But the biggest question that I've been having and the young women have been having is, why do I have to drop out of school before I'm enrolled into Dreams? Should I wait a whole year? What am I supposed to be doing the whole year during that time for me to be eligible to be taken back to school? So that's a biggest question that has not been answered by anyone. So during that time, I'll get into transactional sex or into sex work. And by the time you enroll me, a lot has happened, and you'd find that it's very even difficult for me to take a decision to go back to school, because I've been in a situation where I'm enjoying money and I'm getting more money that I would be getting if I was going to be in an ordinary employment. So those are some of the challenges that we are seeing, and especially the economic empowerment projects. They come in as a buzz where you'd be given a certain project, no proper mentorship, for me and the family, trying to also involve the family to see how that small economic empowerment project I've been given, I can ensure that it yields profits, it can take care of the needs of myself and the whole family. So you'd find that that business that I've started, I've been pushed to do, because one of the biggest things is that if we offer economic empowerment projects, we say, go into agriculture, go into poultry. The biggest question is, how many young women would go into agriculture in this room? How many young women would go into poultry? Young women, you know, when we're talking about young people in general, they're on social media, they are making money on social media, they have different things that are into fashion design, but here we are imposing what they should do. They run that project for 3 months and then they have consumed all the profits, and then we are saying young women are not making informed decision. The biggest question is, are we about quality services, or we are pushing targets when it comes to adolescent girls and young women?
Are we about quality services, or are we about pushing targets? Very good question. Unfortunately, Anne, who's the regional director for UNAIDS and the co-sponsor of this satellite, was unable to participate at very last minute. She was called away to the president's house. So I imagine that there's more important, I can't say more important, but more relevant duties for Anne to fulfill. But we have got the amazing Lysias, who is going to pretend to be Anne, but also speak from his own experience and insights, particularly from UNAIDS. And we've now heard from Catherine and we've heard from Precious. From UNAIDS' perspective, how can programs respond more meaningfully to adolescent girls and young women?
Thank you so much, Sean. And this makes a very good segue to what Anne has prepared, the points that Catherine and Precious highlighted now, the issues that young women and girls they face, be it transactional sex or be it sex work. And the title of this session was very intentional and kind of provocative to hear. And from the poll results I saw, it's clear that 45 minutes of this session is not a good justice to really go into detail into all the issues of this very interesting topic. So I'm going to drill down because Annie, our regional director for Eastern and Southern Africa, he had drilled down into ISA. Now breaking down that data that I highlighted earlier on, but looking specifically for ISA, what those numbers are linking to the issues that Catherine and Precious highlighted. So for ISA, we know, I think we've heard from different presentations in different sessions, even from the opening ceremony, ISA carries the highest burden even among adolescent girls and young women in terms of new HIV infections. We hear, or we have seen data from the Global AIDS report showing that women and girls, they continue to be disproportionately affected by HIV. They account for 12.7 million, according to the latest units estimates, and 63% of those ones are coming from the ISA region. And then when you look at the aspect of whether they are key populations or whether they're involved in transactional sex, you find that there's more data that has been generated around our key populations work, but data around transactional sex is still very, very scarce, highlighting that maybe there's need to do more work around transactional sex among adolescent girls and young women. And then we know that most of the HIV infections occur among young women who are 20 to 24. If you take the data for ISA only, the age group that is contributing most of those infections we're talking about for ISA are among 20 to 24 years, except in South Africa, where it is the 15 to 19 years where most infections are happening. If you really try to paint how that looks like in terms of numbers as well, we are saying 2 in 5 new HIV infections among adults in ISA, according to the latest unit's estimates, they were among young people 15 to 24. And 3 in 4 of those, they're among adolescent girls and young women. Those are very staggering numbers if you really translate them into actual absolute numbers. And one thing, and we've heard from the issues that Catherine and Precious highlighted, gender inequalities and associated gender norms around the region, as well as feminities and masculinities. They are the ones that are really driving behind these socioeconomic factors, driving adolescent girls and young women to be vulnerable to HIV infections, leading to those maps that I highlighted earlier on, showing the different categories of risk categories among adolescent girls and young women, and how they are resulting in the different HIV incidents amongst the population. So when you then look at how we maybe we should consider programming, it's important then to look at let's define it. I think that's very important, right? What is transactional sex and what is sex work? They are different, they're not the same thing. But from what our two our panelists highlighted earlier on, we can see that when you're not looking at new HIV infections or the HIV incidence or the risk of adolescent girls and young women, the driving issues are the same, whether it's transactional sex or it's sex work. The difference is how they are playing out to result in new HIV infections among adolescent girls and young women. We know that for sex work, it is a clear exchange. It's known, you agree from the beginning that you engage in sexual activity and there's money or any other forms of payment in exchange for that. Then for transactional sex, it's more of a non-commercial sexual relationship motivated by an implicit assumption that sex will be exchanged for material support or other benefits we have heard from pressures from her experience working with young women, and for sex work we have heard from Catherine. So when you look at the data, or when you really look at it, you find that sex work is not very open. People don't disclose. So you find that transactional sex is actually more common than sex work. It could be maybe there's less of disclosure and also the stigma around the actual sex work. So you can see there's a lot of complexities around these two issues. But the bottom line is we are seeing high or disproportionate HIV infections among adolescent girls and young women. And we know whether it's through transactional sex or it's through sex work, the driving forces are the same. There's socioeconomic factors that are putting them at risk. There's also empowerment of young women and girls in terms of negotiating safer sex. There's also issues of knowledge as well, to just know that different behavioral actions could lead to them being vulnerable to new HIV infections. So in terms of programming, I think I'll be just highlighting or emphasizing what Precious already mentioned, because when a young woman or girl has to choose between having a meal now or putting herself at risk, at times at the end they might think, okay, I'll see about the risk later. Let me have a meal now. So when it comes to programming, I think this is what programs need to consider to address the issues that adolescent girls and young women face holistically, so that when we come with programs, either providing biomedical interventions, Catherine highlighted, as a sex worker, you have to have your PrEP, you have to have your condoms, but those things, if they are not provided addressing other aspects or other issues, you find that the young woman or the adolescent girl does not have that power to negotiate safe sex, because if a client comes and they want sexual activities in a certain way and they're not empowered to negotiate that, it puts them at high risk, especially if there is other socioeconomic factors, then that will make them to choose, should I go ahead or I should sacrifice and have a meal to eat. So those are the issues that when we're designing programs, we need to look at those in a very comprehensive manner, including education with adolescent girls and young women to empower them to know. And we know that comprehensive sexual education, it helps with that for the adolescent girl and young women to know, even also for their male counterparts, to know how they should be relating with their female counterparts, to addressing those harmful gender norms, addressing masculinities, very, very important. And as we program, in addition to providing these biomedical interventions that we know based on data, when they are available, they cannot work outside addressing these other issues. That's all I can say for now, and over, Sean.
Great. Thank you very much, Tendai. Yes, please give him a round of applause. Because I think it is also helpful for us to hear from on-the-ground experience. And Tendai, I'm going to turn to you now because Zimbabwe has a very strong and quite a well-known sex worker program. Can you share with us how you ensure that the needs of all adolescent girls and young women are addressed in the HIV prevention program?
Thank you, Sean. Afternoon, colleagues. And like you rightly say, Zimbabwe now has quite a mature sex work program, and experience has actually taught us that. Okay, so experience has actually taught us that the categorization can actually be a problem, and we need to mind that blind spot. So you appreciate that in a legally constrained environment, trust is very important. So you notice that our adolescent girls and young women program, as well as our sex work program, are led by communities, because we believe that if a program is to be successful, there has to be trust there. So besides having the CSOs and the NGOs leading our program, we have also embraced what we are calling the DSD models, differentiated service delivery models. It's because we realize that one size doesn't fit all. We really need to go granular. So we are trying to really understand the clients we are serving and develop programs that then meet their needs. So one way we are doing this is through micro planning, where we have also the young women working with other young women and offering support service. And for those that know, micro planning, we learned that concept from India. We also then went to learn at Kenya and Ghana at some point, and we've tried then to contextualize it. So those are some of the things that we are doing. And in addition to micro planning, we've set up what we call the girls' clubs. Why? Because we are trying now to run away from that category of sex work, and we are hoping, and evidence has been that in the girls' clubs, the girls are quite free to come and they're accessing PrEP. And like what Precious said around the pill burden, but we are trying to circumvent that, to try and motivate the girls to work with PrEP champions. Those are some of the strategies that we are using. And in addition, we've just gotten support, I think it's from the Global Fund through UNICEF. We've just re-looked at our screening tool. Why have we re-looked at our screening tool? We've realized that, okay, we might be targeting girls, but they're not exactly the sexually exposed or sexually vulnerable. So we are hoping, we haven't used the tool, unfortunately. We are going to be starting in 2024. So we are hoping some more learning will be coming out of that as we move forward. But really, indeed, it is a blind spot. When we try to categorize, we actually make it even more difficult for communities to get the service. Thank you.
Thank you, Tendai. When we categorize, it can be more problematic. Elements of trust, elements of partnership, elements of solidarity amongst adolescent girls are critical components of the program that Tendai mentioned. We have a couple of minutes for questions to the panelists. So if you do have a question, please just raise your hand and we'll try and get somebody to run around with a microphone. I see the lady in the middle. Please stand. Yes, ma'am, with the flowers on. Apologies that I don't know your name. Is there a volunteer to help with the microphone, please? Thank you, sir. Thanks. Please just introduce yourself, and if we could ask questions short and sweet so we can get as many as possible.
Okay, so thank you so much. My name is Diamond Sapombe, and I am from Zimbabwe, under Say What. So my question is on, since we realize that in some communities, children as young as 12 years old are getting into sex work. So how best can we protect these children? Thank you.
Great, thank you for keeping it short. There's a question over here. Where's my volunteer? Thank you, sir. At the door, thank you very much.
Thank you. My name is Yvonne from Kenya. I had a question around the data that Zambe presented. It's very clear that discrepancies in AGYW and ABYN. What kind of interventions or what kind of programming are you proposing for the other half? Because it's very clear that kind of data is primarily because also of intergenerational relationships. And I feel like we deal with the women, we give interventions to the women, but we don't deal with the other half. And then lastly, around sex work, Catherine talked about decriminalization being an issue. I think sex work is just work. And the perspective that they're doing sex work because they don't have anything else is something we need to reconsider. So I'd be keen on what kind of interventions you're working with governments around that. Thank you.
Great, thank you. And I'll take one more at the back for this round, and then we'll take another round. Right at the back. Yes, please, right at the back. Yeah, thank you.
Thank you very much. I thought this was a really fascinating panel, so thank you. My name is Constance Mackworth-Young, and I work at the Health Research Unit Zimbabwe. And my question is to Precious, because I really liked how you brought up the priorities around putting food on the table, education, and the socioeconomic challenges that are faced by adolescent girls and young women. And in some of our programs, we're trying to incorporate more or integrate broader sexual and reproductive health, and then also more educational, more sort of income generation, skills building programs. But I really wanted to ask you, what do you think should be in terms of programming for us who are in HIV, sexual reproductive health focus? What should we be doing to program for these wider needs? Thank you.
Great, thank you very much. I will ask Lysias to respond to the question on data and how we respond to the other half. And then Catherine, if it's okay for you to respond on young girls involved in sex work, and also sex work is work. And how do you think that programs should respond to that? And then Precious, I think you have a very clear question. No. Yeah.
Thank you, Sean. So the question around what can we do with the data showing that even young girls around 12 years are engaged in sex work. I think we need to embrace this idea of having a comprehensive approach, a multi-sector approach to how we respond. Winnie, UNED's executive director, yesterday highlighted how education or keeping girls in school takes away quite a bit of that risk. When a girl is in school, chances are less likely that they'll be engaging in a number of these very vulnerable. School, it keeps them safe. It's a way to keep them safe until they reach an age where now they can understand they are empowered to make decisions for their own reproductive and sexual health. So Education Plus, which is an initiative that 15 countries have assigned to, I think it's a powerful approach for someone like 12 years. That's a very, very young age. In that case, you wouldn't want to say, let's, of course, the other empowerment means that can be done in terms of providing education to them. We know also in the region there are issues around the policies that needs to be addressed. But for a girl who is 12 years old, I think providing them with these other socioeconomic and addressing those aspects can help them to stay away from sex work and be safe until they reach an age where they know what it is about. If they're doing it, then they know how to negotiate. They are empowered on how to do it. And one of those initiatives that can help that is education, keeping them in school. And we know that when girls are kept in school, data has been showing that they are 50% less likely to be at risk of acquiring HIV.
Okay.
And then
great.
a multi-sector approach is very important. Yeah.
Great. Thanks, Lysias, and apologies for pushing you. We're short of time. Catherine?
Okay, so I'm gonna be answering the question on protecting young children into getting in sex work. So I'm gonna ask this basic question. Which child have you ever seen being employed in an organization at 12 years? None. Sex work is a profession. So even as for ourselves as sex workers, if you are under 18, we ourselves tell you go back to school, but we have organizations that have mother to child programs. If someone is at, we realize a child under 12 years is practicing sex work, we allocate a mother to that child. So the work is gonna be mentoring this child, mental health. They should go back to school. They should do this. So when they are 18 years of old, they are adults to actually do make their own decisions. But our sex workers as ourselves, we do not condone children under 18 years old, nor recruit children under 18 years old. In terms of the second question, interventions with government in terms of sex workers and the programs we are running. So sex workers do not access healthcare provision in terms of sexual reproductive health and healthcare prevention and care. So we are in partnerships in government in terms of health. So we're gonna partner with governments in the health section. This, even though I am a sex worker, I do need healthcare provision. So we work with the in the healthcare government. We want this. We don't have healthcare provision in terms of SRHR, in terms of healthcare prevention and care. And also in terms of the human rights sector, most of us are charged with loitering as sex work, which most of the law enforcers do not actually know where the loitering law came from. So about a month ago, there was a meeting with the African Union. The PALU was there, the Pan-African Lawyers Union, and they actually say the penal codes should be removed for communities because most of the law enforcers use that upon us, but they actually don't know the meaning of some of the laws that they actually use. For example, loitering. It was used when white settlement was being segregated for the black settlement. If I was found crossing a certain place, that was then I was being arrested with loitering. People in our country are still using loitering. For example, if I'm walking or standing around the street, why would you tell me I am loitering? Do you go and arrest people with cars that are going around and around and around saying you are loitering? Huh? So we are using our lawyers to actually set some of the laws that we have because they actually do not even make sense. You're just discriminating some people just because we don't have cars or because you have an end game for something. Yeah.
Great. Thank you very much, Catherine. Thank you. Precious, over to you. And then Kenda, I'll come to you for a last comment on how to ensure that sex workers also access programs.
Thank you, Sean. And I just want to applaud on the kind of programs that are being implemented as per the question that has been posed. But my response would be for us in the room to ensure that we do programs that speaks to gender equality. As long as we become one-sided, then it's going to be a challenge. When we talk of gender equality programs, these are programs that are going to bring boys and men into the table where we are trying to look into issues of structural barriers and power imbalance amongst women and girls. So these are programs where you would have to do dialogues with boys and men in terms of gender norms and trying to make sure that we all speak in the same note and ensure that empower the girls to document their own priorities. Let them know where is the challenge and what are their recommendations in terms of solving that challenge. For us is to give the technical expertise of how now they can craft that particular program. We also need programs that speaks into advocacy and policies where we hold our government, it could be at community level, it could be at national level or district level, where we have our policymakers making commitments and investing money. We're talking about domestic funding, investing money. The government has got funds that speaks to economic empowerment and issue on how also to cap GBV at country level. These are the resources that we're supposed to be using in ensuring that we are reaching to more girls and young women, especially in the hard to reach areas, because programs right now, they look into those that we can quickly reach onto, and then the hard to reach areas become a challenge. So also let's make sure the government put in money, the money is invested, it's not only by talking, and also let the adolescent girls and young women say what works for them.
Great, thank you. Let adolescent girls and young women say what works for them. Tendai, are they telling you what works for them?
So we believe we are trying our level best around that, and we welcome support from opportunities such as the Love Alliance, because we have one huge PEPFAR piece, one Global Fund piece, funding the clinical bit, and then the Love Alliance then comes with all this community strengthening. So we love that smart partnerships, because we believe that if we are going to be investing in clinical and biomedical services, the community has to be engaged, the community has to be ready, and we are moving forward, in my opinion. Thank you.
Great, thank you, Tendai. And I think that's a very good way to end the panel discussion, emphasizing and highlighting the importance of